and reading those cues of distress. And,
Yeah.
early signs of distress are like clenching fists, your fists, wincing,
Yeah.
biting your lips, looking down, closing your eyes.
Blood pressure increases, respiratory can increase as well. Yeah.
What are common medical conditions that co-occur with autism?
Yeah, so commonly we'll have ADHD could be one that is another condition very likely to have an autism diagnosis. We have certain genetic disorders which can be different, depending on the child, can be something that is brand new that has never been seen before. We can see cerebral palsy, very common co-diagnosis, which can affect mobility and can come with other medical challenges. Certainly, epilepsy, seizure disorders, very common. Also, a lot of our kids are from premature births, and so that comes with their own challenges, respiratory issues, sometimes of their mobility problems. Digestive problems are so common in the autism community as well. So really, it feels like an endless list. And that's true really for all of us. If you think about different diagnoses people have throughout the lifespan. Um, I think when you have a child on the spectrum with these diagnoses, there are additional challenges that we sort of touched on a bit in terms of sensory and expecting certain rigid, restricted schedules that may be affected by appointments and where you have to go and what you have to do for your physical health. So there are a lot of challenges for that community, and every child is an individual.
Yeah.
Yeah.
So, for example, sometimes you can use Primine and it can decrease anxiety and have a really positive effect.
Yeah.
You're going to the dentist today and it's going to be great and you're going to bring Stuppy and you're going to get a prize at the end from the treasure box and he's got to put stuff in your mouth like we've been practicing and then other times you can use Primane and it can actually amp up anxiety and trying to like you're going to the dentist tomorrow, you're going to the dentist in 3 hours, you're going to the dentist in 2 hours, you're going to the dentist in an hour, and it's like I don't want to go to the dentist, I'm late. So you really have to gauge from the behavior tells, take
Yeah.
what we're seeing.
Yeah, and I
Child needs in the moment.
absolutely. And I think you point out something that's really important as well, and that is the way that we present it, our anxiety. If we're afraid that this could be something that the kid will not like, and I'm worried about it, and the more I talk about it, the more worried you get. And now we are feeding off of one another's energy in terms of, oh, we're both so anxious. Where if we frame it slower and over more period of time of we're going to drive the car to this parking lot and we're going to go inside and people are going to be very kind and then we'll have your teeth looked at and after that then we'll do something fun, right? So it kind of helps to have a picture in your mind of this is going to go okay, we're going to do all right, we're going to get through it, and we don't need to be afraid. I think that's really helpful.
Yeah, positive thinking, can-do attitude.
Absolutely.
It goes a long day. And if you go into it thinking this is going to be a train wreck, your expectations are probably going to be met. Yeah. So positive thinking. How do you distinguish between a medical problem and a behavioral concern? This level of discernment, we're training our clinicians on it, but it can be tricky to
can.
tell. Yeah.
Yeah, and certain seizures can look even like behavior. For example, an absent seizure, which is really hard to identify because it just looks like, oh, we just looked off in the distance for a moment and then came back. Um, are you just not paying attention to me, or are you having a medical issue? And I think we really need to err on the side of let's rule out the medical issue first.
Always. Yeah. And that's what our ethics say to do is
Absolutely.
like do nothing until you've ruled out medical causes or pain attenuation is what we call
Yeah.
it. And that's really important for ethical practicing of ABA is really ruling out medical causes. So another really common example would be if like a 7-year-old little girl starts having accidents several days in a row, where she hadn't had accidents for a year, that's where we would say you need to go to the doctors and rule out like a UTI that might be
Absolutely.
causing this,
Yeah.
you know.
Yeah, and again, the child doesn't know what these feelings are, so they might not have a way of communicating. I couldn't, I couldn't help it. So yeah, absolutely. Anytime that there's any medical concern, we want to make sure that's being looked after first.
Yeah. Pain tolerance is different in every person, correct?
It is.
But
Yeah.
what signs of pain might look different in autistic individuals?
Yeah. So I think maybe an increase in irritability. Um, you know, you might see more outburst behaviors. You might see increased rigidity, less of a tolerance for change in the environment. Um, Again, like they may not indicate to you what body part hurts or even necessarily like grab their stomach or grab their head because they might not experience it in the same way. You're absolutely right that everybody has a different pain tolerance. Um, and that goes for our children as well. Uh, if they do have a neurological difference, that pain signal might even feel very different to them than it would to someone else, right? So it's really, I think, good to get to know your clients and get to know what is normal, what's our baseline. And then when there's something that is outside of that, then that's when we really need to collaborate with the whole team and make sure that the child is getting the care they need.
Absolutely. And that's one of the reasons why I like the functional analysis screening tool as one of the indirect assessments that I utilize during like a functional behavior assessment because I think it's question 9 and 10. Don't quote me on that, but I think, we ask like, well, what does your child present like when he's ill?
Yes.
And that's when a clinician or a BCBA really needs to pay attention to see like what does that look like? Are they hyperactive or do they shut down and just sleep all the
Yeah,
time?
completely opposite responses from one child to another.
Yes. Looks like the doggies are joining us. My BF Skinner dog.
They're always welcome.
Yes. Um, tooth pain can happen, wincing when drinking hot or colds, pain when brushing teeth. Very important to notice all these signs of pain might look different in different individuals. How can caregivers improve communication with medical providers?